Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita. Ron's not here this week. Not sure if it's a dive heart mission or what, but might be an archery thing. He'll be back on the air very soon. Yolanda and Patricia, I know he has his fan base, and we know that you're waiting.
And I'm Jean Marie, and I have a bass too. It's a bass guitar. That's about it. Oh, okay, actually I'm lying. It's an acoustic guitar.
Well, collectively we're the hosts of PodcastDX. On today's show, we are speaking with Becky. Becky has had quite a bit of trouble with her knee. I don't remember if it's a left or right knee, but I guess it doesn't matter in this case because you can't see it anyway. And she's here to discuss arthroscopic knee surgery to remove damaged cartilage. Hi, Becky.
Hi, Becky. We probably should have told you that we do this recording in the nude.
Good morning.
Yeah, there you go. She's down to earth. Okay. Before we get into your actual diagnosis, I want to talk a little bit about the knee. I'm sure you've learned quite a bit as you were going through the past few years.
Yes, I've had 4 different knee scopes.
Yikes.
You've had 4 different knee scopes?
Yeah, that's a lot. Well, the knee connects the femur or thigh bone to the lower portion of the knee, the tibia and fibula. And the knee is a rather complex joint.
Yep. Tendons and ligaments are also in there to keep the knee joint together. Becky, I understand that you have had arthroscopic knee surgery. Can you tell our listeners about what that was?
Like, what knee was it? Or was it both knees?
It was my left knee,
okay.
And all 4 scopes were done on the left.
Okay.
So you did 4 different scopes.
4 different scopes. I do them about every 3 years. Some of the pain that I have with it is my knee will lock and get stuck, and then I kind of trip and look like I'm drunk all the time. It's definitely a lot of pain before I do the scopes, and that's probably what causes me to end up having the scopes being done is that I can't handle the pain any longer.
Sure.
I've tried a couple of different shots with it.
Okay.
I've done cortisone shots. I've had the Synvis shots, and then lots of therapy, and then we go into the knee scopes because none of them work.
Okay. Do they give you a little bit of relief after an injection? Do you feel a little bit better or not really?
Not really, because it's not hitting the spot where it needs to be done.
Okay.
Mine's more in the front of the kneecap, and so they can't get into the kneecap.
Oh, sure. Right. Yeah. And we didn't even mention the kneecap or patella is another part of the complex knee joint.
Right.
Well, you said that specifically you had arthroscopic surgery, and according to the Arthritis Health website, arthroscopic, I'm not going to be able to say that.
We're going to say this again 4 times.
Arthroscopic surgery is considered a non-invasive surgery. It requires only small incisions through which the surgeon inserts a very small video camera and or surgical tools. And you said you had this done 4 times, and can you tell us about the time that you were able to watch the procedure?
She was able to watch the procedure?
Yeah.
Okay, let me hear about that.
Yeah. That was actually really cool. He,
cool.
The orthopedic, that did the knee surgery actually was pointing out like what was causing the problem and showing me where he was going to trim the cartilage out of the knee that was affected.
So you were like leaning over looking at him?
No, I was on
the gurney and everything.
Yes.
Yeah.
Right.
But they have it as a display, or
they had it on camera, and they were showing me through the scopes and the.
And now you said that was helpful because you could actually see what they were doing and how they were fixing it and everything. Do you think it would be helpful for people to watch a video online if they're not able to watch their own procedure? So like watch it before they go?
I think so. That was probably my favorite knee scope I've had because I knew what was being done, and so I knew that they didn't just go in and cut.
Right.
I actually got to see what they were doing.
So what they did was a debridement and lavage, correct?
Yes.
And tell us about what that is.
I have a tendency to have my knee cap rub against the one bone in my leg, so it's causing the cartilage to hang, and it gets stuck between the 2 bones.
Okay.
And pulls.
Okay.
And so they have to go in and cut the cartilage that's affected, and then clean up the pieces that have actually broken off and is lodged in the knee.
Wow.
Okay. And what do they do? What do they do with it? Do they take it out?
They remove it, and dispose of it.
When I had brain surgery, they removed a piece of my skull, and then they removed actually like a piece of arachnoid tissue, which is technically like the covering of the brain. But I wanted to keep it because this way, when I wanted to give somebody a piece of my mind, I could actually literally give them a piece of my mind. But they said no, they had to send it in to have it tested.
Yeah, I was wondering if they had to test things like that, or maybe.
Not that I know of.
Okay.
I just know that they dispose of it.
Okay, and they do that every time. So you've had this done 4 times, and basically every time is the same kind of thing.
Well, and I understand that an orthopedic surgeon can do a number of things during an arthroscopic procedure, including, but not limited to, trimming or smoothing out the cartilage, like you said, and this when it's growing irregularly or it's bumpy. And then they can also remove irritated synovial tissue, which produces a synovial fluid that lubricates the joint. And then, as we mentioned earlier, the lavage, which is a process by which saline solution is used to flush the joint. And actually, this process can help clear out irritants from the knee joint.
I like that word, lavage.
Lavage. But Becky, like, what was your recovery like for each? And was it easier each time, or has it gotten harder each time?
It's definitely gotten a lot easier. The last one, I was only on crutches for a few days.
Oh.
I was in physical therapy the next week.
Wow.
After it. I had it done last month, and I'm back to my normal running around and doing some jobs. I still have a little bit of difficulty, some pain, but for the most part, it's been a lot better.
Oh, that's amazing.
And what's your typical day like?
I'll get up, take the kids to school, so I typically walk about 20,000 steps a day.
20,000 steps.
When-
How many miles is it?
It's about
That's a lot of miles.
Yeah.
How many, 10?
Yeah, it's about 10.
Oh my gosh. Wow.
When I am having a problem with the knee, I definitely can't. I do a lot of icing afterwards.
Okay.
Ice cupping is probably the best that I've tried. It's I take a Dixie cup and I fill it up, and then I rub, after it's been frozen, I rub the Dixie cup over the area where it's been tender and sore.
Oh, okay.
So it's kind of like a massage with ice.
Wow.
Okay.
I like that.
Yeah.
And
I've never, ever heard of that.
Yeah, that's cool.
It's been the best that I've had so far.
That's good to know. I'm going to write that down.
Yeah.
What is that called? Ice cupping?
Yep.
My new favorite thing. All right.
And you can literally hear her writing it down.
I did, yes.
Yeah.
So what else during the recovery time, helped you?
I'm currently in PT for it. So we do a lot of stair work because that's where the problem is mostly is the up and down on stairs. But
is up worse than down or down worse than up?
Up is worse.
Up is worse, okay.
I could see that.
Could you?
Yeah.
Okay. And do they use those stretchy bands? I remember I did PT once.
I'm not currently using stretchy bands right now.
Okay.
We are doing a lot of strengthening.
Okay.
I think in the next couple of weeks we're going to be adding those back in.
Okay.
Have you ever tried it, or have they ever tried on you a TENS unit where they'll put little electrodes and it'll feel like
vibration
or like rain, hard pattering rain? It can kind of it messes with the body's ability to
concentrate on the pain.
Yeah, focus on pain.
No, I have not had that done.
Okay.
I don't know where you'd put it though. Would you put it around the knee?
Yeah, you put it around the knee.
Huh.
Yeah, and then you have a little unit that attaches to your belt, and it can help with pain.
You kind of dial it up and down.
You can get TENS units now.
At Walgreens or
over the
CVS
counter. Which is
any
kind of
drugstore.
Cool. And did they look at your feet and your ankles to see if that's contributing at all? Do you know if you have a...
Actually, go ahead, answer that first, but I had another question that I was asking her the other day. Go ahead, answer that one first.
Orthopedic thinks that some of it can be related to my foot. I also have had tendon surgery in the foot.
Oh, okay.
And so I have orthopedic
inserts
for my foot, and then a brace on my left foot as well.
Okay.
Yeah, we have a guest that we podcasted with last year that is a foot, Dr. Weil. He's a
sports medicine
medicine physician for feet.
Yeah. And we used to have an ankle surgeon, an ankle specialist, but unfortunately he had a stroke and is no longer working.
Right.
But he used to work on basketball players, ballerinas, soccer players, because that you end up. But he
was a surgeon.
He was an orthopedic surgeon. But yeah, it seems like because the body, if your hips are off, it's going to throw your knee off. If your feet are off, it's going to throw your knee off.
Right.
If your knee is off, it's going to throw your ankles off. So it is kind of like a pile of blocks. They all have to be supported.
Right. And we were talking the other day before we set up the podcast interview that Becky also has another condition, which we're going to be interviewing with her in the future. And it is a autoimmune collective tissue disorder.
Connective tissue?
Connective tissue disorder. That has not been diagnosed properly yet.
Okay, that would explain a lot
and
too.
that may be
that
part of the problem.
I mean,
that kind of, as soon as she said that, I mean, bells started ringing in my ears. It's like ding, 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 ding. That's the problem because
or your tinnitus.
The tendons are connective tissues, and the ligaments are connective tissues, and those. I guess the people at home can't see me with my hands, but the ligaments are holding.
Or the fact that you're naked. I mean,
would you stop with the nakedness?
Okay.
The tendons and ligaments are holding, Becky, look at me. You can see me. They're holding that knee.
Right. It's all like a girdle.
They're holding that knee, that patella, centered. So now it's not moving left and right over the other bone. It's staying right. They're supposed to hold it in the center.
Right.
However, if you have that connective tissue disorder, one or both might be out of whack a little bit and constantly letting it shift. Therefore,
it's rubbing, it's friction.
Therefore, I'm thinking to start with, I would really suggest, not that I'm going to tell you what to do. Yes, I will. I would really suggest having it taped. So tell your physical therapist to
I've
tape
had it taped. Right now, they're not taping it because it's still kind of swollen.
Sure.
So
it's kind of hard to keep it. Sure. That makes sense.
But I've definitely have had it taped prior to the knee surgery.
I mean, you might need to wear a knee brace all the time until they figure out this.
They're trying to strengthen it.
I know. But strengthening it is only part of it. That's only part of it.
I do have a knee brace that I wear when the pain gets a lot.
Okay.
I don't really like to wear it because it's uncomfortable.
Sure.
And I haven't found one that
works well.
Perfect.
Mm-hmm.
Have you tried the external ones? Like the ones that kind of have bars going down the outside of your knees?
That's the one I have. I have one that it has joints in it.
Sure,
so it does allow my knee
You
to
kind of
bend
look
up.
like a Tin Man from The Wizard of Oz.
Yeah,
I like those.
So it slides up and over my knee, and then there's two metal bars that allow my knee to hinge.
Right.
So it doesn't allow my knee to shift back and forth like the problem does, but it does allow me to
the freedom of motion to walk and everything. Okay.
I'm kind of thinking that we were talking earlier about Dr. Lim, who had the stroke. He had a procedure that he perfected. It was a patented procedure. It was the Lim method. And he worked with people that had foot ligaments and tendons that were too weakened when they were doing sports. And he added extra bands of material in the surgical procedure that would act as the tendon and ligament should. And then the person went and they were doing the gymnastics procedures the next week.
Okay. But I'm sure Becky is working with her orthopedic surgeon.
I'm going to just give her suggestions.
Who went to school for it.
Well, so did Dr. Lim.
Okay. Maybe. I know. I'm just saying, Dr. Lita, though,
no,
isn't a doctor, and she doesn't even play one on TV.
I play a doctor on TV. No, I don't.
No, she
okay.
Doesn't. She's always wanted to, though.
This was just suggestions that she could ask her doctor. She can ask her doctor all about it.
Story. Okay. I'm sorry. Did anything else help before or after the procedures, or when your knee starts to, causing you discomfort?
Definitely the icing and elevation really works.
Okay.
Not walking the many thousands of steps I do every day.
Is it hard to not walk when you're used to walking, though?
It is. I definitely am not a person that likes to sit down and relax, and that's probably one of my biggest problems.
Sure.
My orthopedics yell at me for because I walk too much.
Well, if you get into water and water therapy and things of that nature, there's an organization that our co-host Ron works with. It's called Dive Heart. And I don't know if you've ever worked with them, but they'll teach you how to scuba dive and provide all the equipment and everything. And this way you can walk around on the bottom of the ocean and such. Yeah,
easier on the knees.
Cool.
Yeah.
I've done therapy in the pool.
Okay. Is that a little easier on your joint?
It definitely is. It feels a lot better than when I'm up and moving around.
Sure.
Problem is I'm allergic to pool chemicals. So it's
welcome
really
to the
hard.
club. Yes.
It's really hard to find the hospitals that use chlorine.
Okay, right. Okay.
Well, you're allergic to chlorine or not chlorine?
No, I am allergic to bromine.
Bromine. Okay. I'm just the opposite. I'm allergic to chlorine.
Okay. So yeah, the two of you.
Right. You have to find the right place. You're right. I agree. It is difficult.
Mm-hmm.
Or you have to go to an outdoor pool, right? Because then
Right.
it's not, the fumes don't hit you as hard. Yep.
Okay.
I understand that.
Yep. That's
Well, Becky, thank you so much for joining us today. And we've enjoyed talking with you. We're definitely going to talk to you more after your next procedure.
if that's okay with you.
Yep.
Oh, that sounds great. Thank you so much for having me today.
Thank you.
And if our listeners have any questions or comments related to today's show, you can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you have a moment to spare, please give us a review wherever you get your podcasts. And as always, please keep in mind that Lita is not a doctor, nor can she prescribe medical marijuana. And that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.